where a young couple has brought their puppy to see Dr. Boyd. I'm Mark, and this is my wife, Jamie. This is our puppy, Luke. He's 1 and 3 months, and he's here today because he has a lot of trouble walking. Today I'm going to meet Jamie and Mark and their dog, Luke. Luke has been limping for a little while, and we suspect that he has a kneecap that pops to the inside of his knee. I was looking at foster homes for dogs, and I saw him, and we just went, and we fell in love. The first time we met, he came right up and sat on my lap and basically declared us the owners. You know, he adopted us right away. And now he's like our child. So let's take a feel of Luke's knee. If you can just hold on to his head there and whisper sweet nothings in his ear. Oh, there we go. Yeah, so we see that pop right there? Okay, yeah. That's actually the kneecap popping out right there. It is as I suspected. He does have this condition where his kneecap pops out. From what I can tell, I don't think his other ligaments are involved. Sometimes that can complicate things. And the kneecap sits in a groove in your thigh bone. What's happening is when that kneecap pops out, it's riding over the ridge of that groove, and that can be painful because it's grinding down the cartilage. We're definitely going to recommend surgery to stabilize this knee. I think without it, he's going to go on to develop debilitating arthritis. We often see this condition in young dogs, and it's really important for me because I want to make sure that they're going to have a long, happy life filled with running and jumping and playing and all that. I'll let you say your goodbyes, and I'm going to go get his chart and get everything ready. Say goodbye, and we'll see you in a minute. The longest I ever spend without him is if I go to work. We feel bad just leaving him at home, you know, at any point. So, you know, to have to leave him to get surgery, it's kind of upsetting. Yeah. And it's just terrifying because we don't know what's going to happen, if he's going to be okay. Love you, Luke. May the force be with you. We love him more than anything, and we'll be miserable until he's better. He'll be just fine. In X-ray, Dr. Boyd is getting a closer look at Luke's troubled knee. Right there, that's his wobbly kneecap. Ouch. So this is a pretty routine surgery, something that I see quite often. It's relatively straightforward, except if I overcompensate and correct the kneecap's going to pop out the other way. If I undercompensate, it's going to pop out the way it was. So there's definitely a fine art to finding out what the problem is and what's causing the malalignment. So we can see that kneecap. See, this one's in the middle, and then this one's sitting on the inside. So that should really be in the middle of that femur there. It looks like we've got some tibial rotation.